Hey, this is Dr. Sean over at Natural Body Works, and today we're going to talk about ribs being out of place, rib subluxations, and that kind of thing. People come into the office with things like back pain, neck pain, low back pain, and sometimes rib pain, which can go all the way around into the front of the chest. It can get you underneath the, say, the breast area, right into the center of the chest, go all the way around, make it difficult to breathe, give you a lot of chest pain, make it difficult to move side to side. It can stretch and pinch. Some people even have a hard time breathing, and they may think it's a heart attack or an asthma attack, and they'll go and spend thousands of dollars and lots of time to find out it was nothing. We always want to make sure that it isn't anything worse, like a heart attack or an asthma attack, or maybe a gallbladder attack or something like that. But once we've kind of cleared those kind of things out, then we can say, gee whiz, it could be a rib out of place, and I'm going to explain to you how that all works. So here we go. Watch this. I did some drawings already on here. I'm going to explain what they are. This is a front view looking at the chest. Imagine we've taken away the breastbone here. We're looking at some ribs on the right or the left side of the body. They come down. These are the way the ribs are attached. These are the bones of the spine. So here we have, like, say, 1, 2, and 3. They have these transverse processes in the body, and the green stuff in the middle there, that's going to be your disc. Now, the rib attaches not just in the back of the spine, like over in here. Okay, we have here, this is what it would look like from, say, the side view. This is where the spinal cord would go. This is the body in through here. These are the transverse processes, and this is the spinous process up through here. The rib doesn't attach just through here on the back. It attaches actually in the front as well, over in this area, which I was like this. You can see it over here, and I'll explain to how that is. This is the actual head of the rib. This is the neck of the rib, and then this would be the shaft as we come around. In between them, I've drawn in some muscle tissue, and also we can see in here there's 3 little tiny like cables, if you will, and that's called what's called a vein complex. A vein complex is generally a vein, an artery, and a nerve. The nerve is what gets pinched, and that's what causes the pain, and then that tells the muscles to spasm more, and we get that cramping feel and shooting pain throughout the rib. So nerves, artery, and vein come down through this way, all the way inside in that muscle. There's 2 ribs that have overlapped as they've turned around in the front, and they come out here in the front section. Remember, we would have the breastbone, for example, out here with the xiphoid process at the bottom. There's many other ribs. You have 12 on either side. That makes a total of 24, and no, men don't have more than women. That's wrong. Anyway, so we've got here this alignment issue that we can get into if we look over on this side. We turn everything around, we can see the back side. This would be the spinous processes. These are the bumps you can feel on your back, and these would be where the ribs attach to the spine themselves. These are called the transverse processes. And this is the rib, and then of course it goes in anterior into the front. That would be this part here, okay, or like this we talked about. Hopefully you understand that. If not, let me know. I'll explain it more. So imagine if one of these rib joints or spinal segments decides to twist. You're leaning on the couch for a long period of time. It eventually oozes out of shape. This get what's called joint creep through here. This opens up. This collapses down. The muscles respond by saying, okay, we can spasm, and we'll stay spasmed over there, and we'll be stretched out over here. You're going to get lots of pain right in that spot. Usually it'll be right on the back, right off the spine, maybe an inch or 2 off the spine, and that can travel all the way around down into the front of the chest. So what the heck do you do with it? Well, if we start to look at how we can manipulate the body, a couple of things that I tell people to try and do is, number 1, stretch. Stretching sometimes can be very painful, though, if the muscle's in spasm and the nerve's been irritated enough. So we want to do heat for the muscle spasm and the muscle tightness. That'll help sedate it and get some blood flow in there and help it loosen up. If that doesn't work, all we have to do is come on in and get adjusted. Very simple to do. We find the segment that's out of alignment. We look below, and here's the disc again that we saw from the other drawing over here. So we can see the disc from the back. We find out where it's been moved out of place, and then we can simply pop it back into place. It's not very hard. It's very, very safe. You just got to make sure you're contacting these, not out here. That's all we have to worry about. Heat, muscle stim can help with those kind of things. I really like those medicated patches, salon passes, things like those. I use them myself when that's happened. Ribs tend to go out for no other good reason than because they really want to. generally, I haven't seen, in 20 years of practice, I haven't seen people say that, oh, they fell out of a tree or was run over by an elephant or anything like that. Usually it's reaching for the remote, washing their hair, brushing their teeth, something very simple and mundane as that. Anyway, so there you go. So here we've got proper alignment where there's the disc in the middle of the bone, the body of the spine. Here it's a front view looking through. Remember, we have the heart and the lungs would be in through here. We have the lungs, how they turn around, the ribs, how they turn in front of the body over to this way. So they're coming out at you, out towards this way. Over here, I've kind of drawn, I'm not sure if you can see it, if we're looking at you from face down, if you're face down, we're looking straight at your back, this would be a rotational component to it. So when you lay down, you would see a higher section on one side. Now this is common in people that have scoliosis, for example. We see this an awful lot. We also see this an awful lot. Can it be corrected? Yes, we can get some of that to loosen up and correct, but no, we can't really correct scoliosis. No one knows why. No one knows even why it happens. And so, but what we want to do is we want to make sure and incrementally, slowly, start to move any areas that are out back into place, and hopefully these muscles and these muscles will start to cooperate and understand what's going on with the joint complex, and then we can get everything to start working better. The idea is, of course, alignment is one part of it, but really I go after muscle weakness, muscle strength, muscle tone, and muscle balance, as well as function. What kind of flexibility can we do? Remember, the bones don't go anywhere unless the muscles tell them to, so let's get the adjustments going, and then we can loosen up the muscles, or vice versa. Whichever one works the best is the one we want to do for you. So if you have a rib out of place, give me a call. The number I'll put down here somewhere, and you can make an appointment or text me. You can text me for appointments as well. This is for specific patients. You guys know who you are. I've made this for you, and I will post it on our YouTube page, so make sure you share it and tell other people, like, hey man, this could be a rib out of place and it's very easy to fix. I've had people spend days in the hospital, get weeks of injections and all kinds of things to find out it was a simple 1 or 2 visit correction, and they were fine. So spend your money how you want to. Anyway, this is Dr. Sean over at Natural Bodyworks here in Parker, Colorado. Thank you very much for watching. Hope to see you guys soon. Take care.